Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Pelvic organ prolapse quantification system classification. The reference point for pelvic organ prolapse quantification system is hymen. Anterior wall of vagina, we have 3 points AA, BA, and C. AA lies 3 centimeters above the hymen on the anterior wall of vagina. BA is a point which is the most dependent part of anterior vaginal wall between AA and anterior fornix. C is the anterior fornix. Then posterior wall of vagina. In posterior wall of vagina, we have AP. AP lies 3 centimeters above the hymen on the posterior wall of vagina. BP indicates the point which is the most dependent point of the posterior wall of vagina, which is between the AP and the posterior fornix. D is the posterior fornix. Anything above the hymen is indicated by minus sign and anything below the hymen is indicated by plus sign.
thank you and thank you for watching.